What if I told you that your smile might hold secrets about your heart health, or even your risk for cancer? Sounds unbelievable, right? But in today's video, you are going to discover how oral health is far more than just cavities, whitening, or bad breath. Your gums, your teeth, and yes, even the bacteria in your mouth, could be fueling problems across your entire body. Stick with me until the very end, because what you uncover today could genuinely save your life. After this, you'll never look at brushing the same way again. When was the last time you actually changed your toothbrush? Be honest, type it in comments below. Most of us learned as kids that brushing your teeth helps prevent holes, and that dentists fix cavities. Sounds simple enough, right? But what if I told you that skipping your dental checkup could increase your risk of a heart attack? Or that the bacteria in your gums might be fueling cancer cells somewhere else in your body? Suddenly, it's not so simple anymore. According to researchers at Harvard Health, gum disease isn't only about your mouth, it creates inflammation throughout your entire body. And inflammation, as many of you know, is a root cause in diseases like heart disease, type 2 diabetes, and even certain cancers. So, instead of thinking of oral health as something minor or cosmetic, start thinking of it as your very first line of defense for your overall health. In other words, the mouth is not a separate system, it's the control room. And guess what? If something in your mouth goes wrong, the whole system can collapse. Look at your gums next time you brush. Do they bleed? Type yes or no right now. Now you may be thinking, okay, but how does a little gum infection in my mouth affect my heart? Here's the science. When you have gum disease, also known as periodontitis, the bacteria living on your teeth don't just stay stuck there. They actually slip under your gums, enter your bloodstream, and travel throughout your body. Once in your arteries, these bacteria trigger inflammation, and that makes arteries stiffer and narrower. Over time, this leads to blockages. Studies published by the American Heart Association show that people with severe gum disease are 2 to 3 times more likely to have a heart attack or stroke. Imagine your gums as the entry gate to your bloodstream. Healthy gums are like a locked door. Weak, inflamed gums, they're like a broken fence, letting invaders march straight into your bloodstream. And once they're in, the battle isn't local anymore, it's systemic. So brushing and flossing? It's not just about fresh breath, it's literally about preventing clogged arteries. That's right, your toothbrush could be a weapon against a heart attack. Did it surprise you that gum infections might play a role in affecting heart? Now, let's take this even further. Scientists are now discovering links between oral health and cancer. One particular bacterium called Fusobacterium nucleatum, often found in gum infections, has been shown to accelerate the growth of colorectal cancer cells. Think about that for a second. A bacterium in your gums, helping cancer grow in your intestine. That's how interconnected your body truly is. The National Cancer Institute has pointed to research connecting poor oral health to not only oral cancers, but also throat and pancreatic cancers. Let me tell you a story to illustrate. Imagine a 45-year-old professional, let's call him Mr. X. He ignored his bleeding gums for years, thinking it was just a brushing problem. But those tiny bleeds meant harmful bacteria were constantly entering his bloodstream. Years later, after he developed digestive symptoms, he was diagnosed with colorectal cancer. Mr. X survived, but his doctors later explained that his gum health may have been silently fueling that disease for years. Of course, not every case of bleeding gums leads to cancer. But the connection is real enough that scientists are racing to study it more carefully. So next time you see even a drop of blood when you brush, remember, it might not just be your gums crying out. It could be your body waving a big red warning flag. Did it surprise you that gum infections might play a role in cancer? Comment surprise if this blew your mind. Now that you understand the risks, let's talk about the warning signs to look out for. Pay close attention here, because these are your early alarms. Bleeding gums after brushing or flossing. Red, swollen, or tender gums. Chronic bad breath, no matter how much you brush. Loose or shifting teeth as an adult. Pain when chewing. Most people ignore these signs, thinking, oh, it's nothing, it's just brushing too hard. Wrong. These are not normal, they are signs of infection and inflammation. And here's the scary part, your body whispers before it screams. If you listen to these whispers, you might just prevent a heart attack or worse. Okay, so what can you actually do? The good news is, you already have the tools. Step 1. Brush twice a day with proper technique, 45-degree angle, 2 minutes each time. Step 2. Floss daily. Yes, daily. Think of flossing as cleaning the hidden half of your teeth that brushing never reaches. Step 3. Use a tongue scraper or gently brush your tongue. It reduces bacterial load by almost 40%. Step 4. Eat for your teeth. Cut back on sugary snacks, sodas, and energy drinks. Add leafy greens, vitamin C-rich fruits, and plenty of water. Step 5. Quit smoking and reduce stress. Both are major contributors to gum disease. And finally, Step 6. Get regular dental checkups. Waiting for pain before seeing a dentist is like waiting for chest pain before you start exercising. Too late. Think about it, a 25 rupees toothbrush, used correctly every day, can prevent a 2,500,000 rupees heart surgery. Isn't that incredible? Busting oral health myths. Before we wrap up, let's bust some myths, because these misconceptions are quietly harming millions of people every single day. Myth number 1. Bleeding gums when you brush are normal. False. It means your gums are inflamed. Think of it as your mouth crying for help. Myth number 2. Sugar-free drinks don't harm your teeth. False. The acidity erodes your enamel almost as badly as sugary sodas. Myth number 3. You only need to see a dentist if you are in pain. False. By the time you feel pain, you are already deep into advanced damage. Prevention is far cheaper, faster, and less painful than treatment. Believing these myths could cost you your smile, your heart health, and your life. So tonight, when you brush, don't do it mindlessly. Do it knowing those 2 minutes could prevent a heart attack, fight cancer, and extend your life. Let's tie it all together. The bacteria and health of your mouth don't just stay in your mouth, they travel, they invade, they inflame. They affect your heart, they affect your brain, they can influence cancer growth. So the next time you reach for your toothbrush, remind yourself, you're not just cleaning your teeth. You are protecting your arteries, you are protecting your immune system, you are protecting your life. Your toothbrush might just be the cheapest, most powerful medicine you'll ever own. Promise yourself right now, type "I'll brush plus floss daily" in the comments. Make it official. If this video opened your eyes, please hit like, share it with your loved ones, and subscribe to PharmaHealth Insights, where we uncover the hidden science that protects your health. Until then, stay healthy, stay smiling, and remember, oral health is total health. This video is for informational and educational purposes only and does not constitute medical advice. The content is not intended to replace professional consultation, diagnosis, or treatment by a qualified healthcare provider. Always seek the advice of your dentist, physician, or other qualified health professional with any questions you may have regarding a medical condition or oral health concerns. Do not disregard professional medical advice or delay seeking it because of something you have seen in this video. PharmaHealth Insights is not responsible for any health outcomes related to the use or misuse of the information presented.